Welcome to the Impact Over Optics podcast, a place where real progress shines beyond appearances and distractions. Here, voices from across industries come together to share wisdom, stories, and strategies that remind us what's possible when purpose leads the way. Because true progress is not measured by how it looks, but by the impact it leaves behind. Let's get started.
Welcome to Impact Over Optics, the podcast where we go beyond appearances and focus on what really moves the needle: authentic leadership, purposeful results, and lasting impact. I'm your host, Jon Detweiler, and today I'm extremely excited to be joined by Dr. Orlando Rivera, an accomplished author, business owner, medevac flight nurse, and healthcare executive. He is the author of You Can't Chart Gut Instinct in the EMS Decision Bible, where he explores how experience, pattern recognition, situational awareness, and disciplined thinking shape the high-stakes delivery of healthcare. Respected for his ability to translate complex concepts into practical insight, Dr. Rivera reinforces a critical truth in healthcare. When the algorithm stops making sense, judgment matters. He's also an avid extreme obstacle course race athlete who understands that it's the small, consistent daily habits that lead to success. Let's get right to it. Dr. Rivera, thank you so much for joining us on this episode. You have done some incredible work highlighting healthcare providers and the work that they do. Do you mind sharing about a current project that you're working on that you're particularly proud of?
Hey, John, thank you for having me. Absolutely. So we have several projects going on right now. So at Beyond the Chart, what started as a bucket list item of writing a book and being able to say, hey, I wrote something, turned into this massive machine and operation where, based on the feedback we get from EMS providers, nurses, and even regular people, we come up with ideas and what else can we use our platform for? I've been on LinkedIn for a number of years, posting, all kinds of different things, some good, some inflammatory things, but never inflammatory for the sake of inflammatory, just asking the hard questions and just putting it out there just to see how people react, get people talking. That's the first step. And so we have a couple of books coming out in the near future. One of the things we're passionate about is the next generation of leaders. So when it comes to teams for nursing and EMS, we're thinking, what can we do to reach them, to give them a heads up? So you want to be a nurse, so you want to be an EMT. Here are the things that you really need to think about before you embark in a journey like this.
I absolutely love that. I've read two of your books already. I have plenty more queued up to go through. But when you did You Can't Chart Gut Instinct, it was such an incredible book that was truly a gut punch, but really validated a lot of the things that, as a provider, you and I have been both doing this for a very long time, validated a lot of what we did. So thank you for the work you're doing in that space. Thank you for the conversations. I enjoy following you on LinkedIn and seeing your posts. Again, it's a conversation that is worth having, and I appreciate you taking the steps to do that. So this month's topic is on daily rituals. Let me ask you this. What's the very first decision you make every morning, and why does that matter?
First decision. Well, for me personally, it's movement. We were talking about the obstacle racing and the athleticism of things. A few years ago, I had a health scare. I had a right carotid dissection at the time that came out of nowhere. I had no history of it at all. And so I had to be on, blood thinners for a number of months. Everything's healed. Everything's great. But that was a wake up call to care about my health. And so for me, movement is number one. That's the first thing I think about when I wake up in the morning. You can find me at the gym training every morning at 5:30 in the morning. That's sort of my quiet time, my me time, what energizes me to tackle the day.
I love that. That is such a great way. So let me build on that first decision, sort of roll into setting your day up for success. Because let's be honest, if you don't set it up for success, you and I both know how it goes. But I think that when you set the tone, you ultimately establish the ceiling for capacity that day. So what's one morning ritual that looks insignificant, but actually has a massive impact on you?
So in the past, I have not been the most organized individual, but as of late, I have to be. So just reflecting on what your day ahead looks like and planning ahead. It doesn't have to be anything official, a journal or a diary, just a mental outline of what's important and how you're going to tackle every single thing. Along with that, setting yourself some goals. Again, doesn't have to be this elaborate formal thing. It's just in your mind. What do you want to accomplish today? Do you want to accomplish one thing or three things, and what's important? Just triage that in your mind, create an outline, and then just go from there.
So when your morning gets hijacked early, what is the downstream impact on your patience, clarity, and decision quality? Because I just give the disclaimer: I don't deal well with the sideways morning at 7:30 already. My day just it starts at bad. But what happens when that happens to you? How do you recalibrate? What do you do?
That's a really, really good question, John. And so, of course, it has an impact. Sometimes you get swept into somebody else's emergency or somebody else's sort of day. Patience is golden, right? So you have to be patient. And then, at least for me, is how can I incorporate this, detour into my daily goal or my daily routine? Many times, a lot of those interruptions are tied to what I need to accomplish that day. At least in my case, that's sort of I'm lucky that way, where I don't really have a lot of outside influences other than, I don't know, I dropped the weight on my toe at the gym and that may derail my day. But other than that, it's all related to work. And so reprioritizing, writing that mental checklist and how I'm going to tackle things. But it takes a lot of patience. And sometimes, we're all human and, you have to cultivate those habits and be patient and understanding and empathetic.
I love that you said cultivate those habits because I think that too often we just assume that like we can pick something up and do it where you think you can do something much better than you do. So, yeah, cultivation is a
Mhm.
great word when we talk about those things. So, obviously, we're not in our 20s anymore. Our lives have become a lot more complex. How have your morning habits changed as your responsibilities increased? Like, did you have things that you needed to let go of from a habit standpoint?
Absolutely. When it comes to habits, we touched on movement, we touched on my passion for fitness. I used to be able to do that anytime, anywhere. Now I've had to adjust and become really a morning person just to get that in before the day sort of gets away from me, right? And so my fitness and what's important to me, because it's the foundation of everything else you do. If you have your health and you have a clear mind, you can really accomplish anything. So moving things to where I can achieve them, it's important. Not finding excuses. I like to sleep in just like the next person, right? But if I do that, then I forfeit a lot of what is important to me and what fuels me and what drives me. So just being flexible and making sure that you find a spot for whatever it is you need to do and not just drop it.
It's an incredible answer. Thank you for that. So I feel fairly confident in saying that as your responsibilities have increased, so has your stress. So let's talk about how rituals hold up under pressure. Rituals tend to fall apart during our high stress seasons. Which of your habits that are important to you actually held up when pressure, responsibility, and uncertainty increase?
So reflection, slowing down, almost like meditation in the sense that you have to slow down, right? When stress hits high, the physiologic changes that happen in your body, right? Heart rate, everything increases, and your anxiety goes up. But you have to make a conscious effort to really slow down, take a pause, and really think about how this is impacting you. And is it a bigger deal than your mind is telling? Because at least in my experience, my mind tends to make bigger deals of things that they actually are. And so long as you know that up front and recognize that and able to take a pause, look inside and see how is this really affecting me? Is it really something important or am I making it some more than it needs to be?
That is incredible. So you talked a little bit about your medical scare there. Have you ever had to rebuild your rituals after burnout, a major failure, setback, or a season of sustained pressure?
Absolutely. And so I'll give you an example. Before my carotid dissection, I love riding my motorcycle. I was always on my motorcycle. I would take it to work. I would drive it on the weekends. It was a great, an important part of my life. Brought a lot of joy to my life. After the dissection, I had to be on blood thinners, and I don't need to tell you the implications of injury, especially head injury, while you're on some of these powerful meds. And so that meant the end of me riding, and not because I just didn't like to ride anymore. I was just too scared. It was too much of a risk to put myself through. So that changed, that went away. And then the focus on health was what replaced that. Whereas before it was about riding a motorcycle and just having fun. Now it was about how do I regain my health? What are the factors that are going to keep me healthy for the long term?
So, and I think it's fair to say that rituals are a personal responsibility, right? Nobody gives us our rituals to help us grow. They're ours. What advice would you give somebody who's trying to build them without turning their day into like a rigid checklist or some type of performance theater? What would you say?
I would say take one step at a time. Try to avoid making significant big changes all at once. It's all about the small habits. So, for example, if your goal is to be able to get up early in the morning and be more productive, don't just start waking up at 4 a.m. Perhaps wake up 30 minutes before your normal time. Small little baby steps will take you where you need to be over the long term. It's just like training, right? You don't go in to lift and, lift 100 pounds, 100 times and you not be able to move 3 days later. You have to start slow. You warm up to things. And what you'll find is with the small little changes, they'll become normal in your life. And you won't even be able to recognize where you are in the long term if you follow and just do one small little thing every day.
Absolutely love that. A chief that I work very closely with talks about the 1 and 2%. Every day is about being
Mhm,
1% better, 2% better. Don't try to change your world. It's the incremental changes.
mhm,
That really resonates with me as well. So you have held a lot of different leadership roles and not
mhm,
just supervision, but up to executive level roles. I want
mhm.
to ask you about your rituals that support leadership signals, and those being the sort of intentional actions, behaviors, and communications that leaders display to shape organizational culture, demonstrate credibility, and guide team perception. So, what leadership behavior have you seen people imitating that you never explicitly taught? A modeled behavior that they just picked up, but you didn't even realize you were showing.
That's a really good question, John. And so I have seen that actually firsthand. So in my tenure as director of cardiovascular services, I had a small team of quality nurses and other abstractors, et cetera, that work under me. We had a really, really good team going. And so one particular individual was their first role outside of bedside nursing. So typically, I'm more of the, do as I do and not as I say. I try to set a good example. I have a really strong moral view of treating people right, quote unquote, the nice guy. Anybody that knows me probably knows I'm a nice guy, so to speak. And so making sure that my team was taken care of, that I was fair within what I could do for them was super important to me. I never sat and talked to them about that. It was just something I personally did. Years later, one particular nurse, Chelsea, decided she wanted to progress. Her first non-bedside role nursing was at the Heart Institute. And she decided, you know what? I finished my master's. I'm going to go and be a director. And so we had a conversation. She's a better director than I could ever hope to be. And what's funny is that you see a lot of how we were as a team. You see her doing that with her team. And so, being good to your people, advocating for your people, and understanding that you cannot always give, staff what they need because, depending on where you are within the executive leadership level, it's just not your decision. But there's a lot you can do to advocate for your people. And that's what I see. It's like a clone of how I used to treat them, but now it's just another cell that popped up, that she manages.
Again, that's such an important piece of leadership, and all the things we do model behavior that we want our teams to follow. So that's really incredible. Let me flip this now and take it the other direction and say, what's one habit that you've changed specifically because you realized people were modeling it? Do you have one of those?
Yes, perhaps not in the professional environment, although I consider myself a professional when it comes to athleticism because I'm also a boxing fitness coach, certified. So I teach a class 3 times a week at the gym I go to. And so one of the things that I'm terrible at is resting. Rest days, they're difficult to get. And so oftentimes you'll see me at the gym completely run down, and people will ask, when was the last time you take a day off? Well, I don't remember. Well, that's important. I say, I know that, but from knowing that to actually doing it. And so some of the students tend to have the same attitude. No, let's just go, go, go. Well, no, resting is just as important as, putting in the work. That translates to your professional life. Like you said, people coming in early and emulating that behavior. So is, just going 100%, 100 miles an hour every single day, every time. There is power in the pause. You need to pause at times to reevaluate to see where you're going. Do you need to course correct? And that's difficult to do if you're just going and going.
So very true. So, how can leaders encourage healthy rituals without turning them into policy or pressure or some type of performative wellness? Like, ultimately, how can we encourage people to pick up habits without making it something they need to do?
That's a really good question, John. And I think it goes back to leading by example.
Mm.
You have to be consistent with your behavior, and you have to be consistent not with just what you do, but also with what you say. If you're consistent with the way you portray yourself, that will stick. That will encourage people to model that naturally without having to rely on a policy or some sort of punishment, stick and carrot type of system. So consistency in your leadership acumen and your leadership process.
It's a good reminder, again, just on the leadership side, how important consistency is. I know it's a struggle of mine because, again, when you get into the grind of the day, sometimes staying consistent and following through is really tough. So I'm glad that you called that out. Let's do some real quick rapid reflection questions. We give these.
Mm.
We toss these out so our leaders sort of get an idea of what your thoughts are in a brief 1 to 2 sentence reply to each one of these. So, first one habit that leaders need to start doing immediately.
Movement, leading by example.
That's great. What is one morning habit you refuse to skip?
Oh my goodness. Again, movement, taking care of your physical body because it's the foundation of everything else you do.
Perfect. What is something you intentionally don't do first thing in the morning?
I don't stress about what's ahead.
Hmm.
I stick to my routine and I build that.
I love that. That is incredible. And again, such power in being able to not look too far ahead and get stressed over it. It's incredible. Last one. What is your number one signal that it's time to step away and reset?
Well, when you start not enjoying what you do, and I don't say it in a superficial way, but you're not passionate, there's no passion behind what you do, that is a signal that perhaps you need to reevaluate.
Really good. Really good. This has really been incredible, and I appreciate your time, Dr. Rivera. We ask all of our guests the same question as we close out the episodes. If listeners walk away with just one message today from you, what would it be?
So for me, I'm big on judgment. In EMS and in healthcare, there's a lot of gray areas. John is the foundation of a lot of what I write. There are protocols and there are ways to do things. They seldom capture every single scenario. So what you have to rely most on is your judgment. And judgment is not also something that needs to be developed and cultivated. And so how do we do that? If you remember nothing from what I stand for and what, we're about at Beyond the Chart is that judgment is one of the most important pieces that you can develop to be a good leader and a good healthcare provider and a good human.
I'm glad that you included that last part, be a good human. It is something about you that I've always respected from the days that we worked the street together all the way through the time that I've known you. Be a good human. And that's a choice that we all make. So Dr. Rivera, thank you so much for joining us on Impact Over Optics. If you want to follow the work that Dr. Rivera is doing, I would encourage you to go to his website, beyondthechartpublishing.com. He has access to everything else that he's doing in that space, links to the work that he's done through LinkedIn and with the Journal of Emergency Medical Services. Just a really good opportunity to connect. This has been phenomenal. Again, I'm Jon Detweiler, and remember, authentic change always outlasts appearance. Until next time, lead with purpose and leave a real mark.
Thanks again for joining us on the Impact Over Optics podcast. We hope today's insights sparked fresh ideas and reminded you of the power of purpose-driven work. Please share this episode with others who believe in real change, and join us again as we continue to look beyond appearances and focus on the impact that truly lasts.